Hello everyone. So today we are going to learn about the trigeminal neuralgia. So it is also known as prospopalgia or Fothergill's disease. So this is an extra point. That's it. So definition. Definition is it is a neuropathic disorder which is characterized by sudden, unilateral, severe and intense lancinating type of pain. Okay, remember this point. Lancinating type of pain in the distribution. Which distribution it is? Wait a minute, cutaneous. Okay, in the cutaneous distribution of the fifth cranial nerve, that is the trigeminal nerve. Okay, so now let's learn about the etiology. So etiology, it occurs because of the compression of the trigeminal nerve at or near the pons by an ectatic vascular loop. So what are these? Either maybe because of the meningiomas or etc. So because of these vascular loops, the nerve gets compressed and you are gonna get this neuralgia. Other causes where you see this trigeminal type of neuralgia is, one is intracranial tumors, vascular abnormalities and petrous ridge compression. In near the ear we have a petrous bone, which in this petrous bone only this fifth cranial nerve is present. So this petrous ridge compression causes trigeminal neuralgia. And viral etiology, multiple sclerosis, post-traumatic neuralgia, demyelination and other causes idiopathic. Okay. Now we'll learn about the clinical features. So the most common clinical feature is pain. So how it is the type of pain is? So it is a sudden, unilateral, intermittent, on and off type of pain. Knife-like or lancinating. Just now I told you lancinating type of pain. It occurs in the mostly unilateral only. If this is the face, it occurs only unilateral. Rarely it will cause this midline and travel to the other side. Okay, so mostly it is unilateral only. Now the patient have motionless face, means because of the pain the patient can't move his face and he looks like frozen or mask like face. Okay, the face of the patient looks like frozen or mask like face. Now the duration of the pain. The duration of the pain is of short duration, but it will reoccur with variable frequency. Okay, and the attacks do not occur at the night. Now the pain, I told you, pain is along the cutaneous distribution of the nerve and mostly that is along the mandibular division. Okay, and the pain is precipitated by minor trauma, like to the trigger zones. On the face we have trigger zones, and these trigger zones are like mostly nose is there, no? Now ala of the nose and corners of the lips, and we have corners of the lips and cheeks. Okay, now the pain is precipitated by minor trauma. The trauma are like slight touch, chewing, shaving, exposure to the cold wind. Just now I told you the trigger zones. So they are ala of the nose, corners of the lips and cheek, and the intraoral. In the oral, the trigger zones are teeth, gingiva and the tongue. Okay, now here comes the treatment. So the first line treatment is carbamazepine. It is an anticonvulsant drug. Now the second line drug is baclofen, sodium valproate, oxcarbazepine. Now we have the pain, no? So this localized pain is managed by long acting anesthetic drugs like alcohol injection and peripheral glycerol injection. Now if these drugs are not worked, or if the drugs are contraindicated or tolerated, surgery is done. So what surgery is done? One is peripheral neurectomy, another one is open procedures, means treating intracranial tumors, intracranial lesions. Okay, and microvascular decompression and gamma knife radio surgery. Okay, this is all about neuralgia. I hope you guys understand it. Thank you for watching. Please subscribe.